Imagine you're lying on an operating table. The lights are bright, too bright. The surgeon leans over you. The anesthesiologist tells you to count backward from 10. 10, 9, 8. Everything goes black. But then, suddenly, you hear a voice. It's the surgeon. Someone asks for an instrument. You try to open your eyes, but nothing happens. You try to speak, but your mouth will not move. You try to lift one finger. Nothing. And then the worst thought arrives. Wait, am I awake? This is not a horror movie. It has a real name, anesthesia awareness. It means a person becomes conscious during surgery and later remembers parts of it. The good news is that it is rare. The bad news is that rare does not mean impossible. So what actually happens if you wake up during surgery? Would you feel pain? Why would your body stay frozen? Why does this happen in the first place? And what can it do to your mind afterward? To answer that, we first need to destroy one common myth. General anesthesia is not just sleep. Sleep is natural. Your brain is still active. A loud noise, a shake, or your phone alarm from hell can pull you back. Anesthesia is different. It is a controlled medical state. Doctors are not simply pressing a button labeled nap. They are controlling several systems at the same time. Awareness, memory, pain, breathing, reflexes, and movement. That is why surgery can happen without you remembering it, reacting to it, or jumping off the table like a terrified raccoon in a hospital gown. Which, honestly, would be understandable. General anesthesia usually involves different types of drugs working together. Some reduce consciousness, some block pain, some interfere with memory formation, and in many surgeries, muscle relaxants are used to stop the body from moving. That last part is where the nightmare begins. Muscle relaxants do not make you unconscious. They do not block pain. They do not erase memory. They only stop your muscles from moving. That can be medically useful. Surgeons sometimes need the body completely still. Doctors may also need to place a breathing tube and control breathing safely.
But if awareness returns while muscle relaxants are still working, your mind may be awake while your body is locked. You cannot speak, you cannot wave, you cannot blink on command, you cannot scream. Your body is basically in airplane mode, except your brain is still receiving notifications. Now, anesthesia awareness is not always the full nightmare people imagine. Some patients remember sounds, a voice, a monitor beeping, a sentence from the surgical team. Others remember pressure or tugging, but not sharp pain. Some remember only panic without clear images. And some do not realize what happened until days later when a strange memory returns. A sound, a phrase, a ceiling light, a fragment from a place they were never supposed to experience. So why does anesthesia awareness happen? Usually it is not because someone simply forgot to give enough medicine. That answer is too simple. The real answer is messier. First, anesthesia is a balance. Too little can allow awareness. Too much can lower blood pressure, slow breathing, or become dangerous for an unstable patient. Second, every body reacts differently. Age, weight, medical conditions, medication use, alcohol use, and drug tolerance can all change how a person responds to anesthesia.
Third, surgery itself changes minute by minute. Blood loss, shock, pain signals, fluids, and medications can all shift what the body can safely handle. And fourth, muscle relaxants can hide one of the clearest warning signs: movement. If a patient is lightly anesthetized but not paralyzed, the body might move. That movement could warn the medical team that something is wrong. But if muscle relaxants are active, the body can look calm even when the mind is not. That sentence is horrible, but it is the key to the whole problem. Doctors are not just watching whether you move, because movement can be blocked. So they monitor heart rate, blood pressure, breathing, oxygen levels, anesthetic concentration, and sometimes brain activity.
If your heart rate rises or your blood pressure jumps, it might suggest pain, stress, or light anesthesia. But the body is messy. Heart rate can change for many reasons. Blood pressure can shift because of bleeding, medication, stress, or the surgery itself. The human body does not come with one clean red warning light labeled "patient is awake." That would be convenient. Also terrifying. So why would anesthesia ever be kept lighter? Because in some operations, the biggest danger is not awareness. It is survival. Emergency trauma surgery is one example. If someone has lost a lot of blood, their blood pressure may already be dangerously low. Too much anesthesia can lower it even further.
In that situation, doctors may need to balance unconsciousness against keeping the heart and circulation stable.
Heart surgery can carry similar challenges. Emergency C-sections can also be complex because doctors may need to act quickly while considering both mother and baby. This does not mean patients are casually left awake. That would be nonsense. It means medicine is sometimes a brutal balancing act. Too little anesthesia risks awareness. Too much anesthesia can be dangerous for a fragile patient. This is why anesthesia is not a background detail. It is one of the most active jobs in the room. While the surgeon operates, the anesthesia team is managing the body like a live control system. Breathing, circulation, oxygen, fluids, drugs, pain control, and wakefulness. Everything is changing. Every minute matters. Now, let's answer the question you probably had from the beginning.
Would you feel the surgery? Usually, anesthesia awareness does not mean full pain. Many cases involve sounds, pressure, or vague sensations rather than severe pain. But painful awareness can happen, and that is the version doctors fear most. Pain depends on which parts of the anesthetic system are working and which are not. A patient could have enough pain control but not enough unconsciousness, or enough muscle relaxation but not enough awareness control. That is what makes this so unsettling. Anesthesia is not one switch. It is a mixing board. Turn down the wrong slider and one part of consciousness can leak through. Hearing is especially strange. Your ears can still receive sound under anesthesia. The real question is whether the brain processes it and stores it. Sometimes it does. That is why a patient might remember a surgeon's comment, a nurse's voice, or a sound from the room. Not the whole operation, just a piece, a shard of reality. One well-known case is Donna Penner, who described waking during abdominal surgery and being unable to move or communicate. Her story became widely discussed because it captured the most frightening part of anesthesia awareness, not just sensation, but total helplessness. And that is where the consequences begin. For some patients, the surgery ends, but the fear does not. The aftermath can include anxiety, nightmares, panic, flashbacks, depression, and trauma-like symptoms. Medical sources describe awareness under anesthesia as a complication that can lead to significant psychological effects, including PTSD-like consequences. Some people become afraid of hospitals. Some avoid future medical care. Some keep replaying the moment when they realize they were trapped inside their own body. Because the brain does not care that the event was rare. The brain cares that it felt helpless. That is the emotional core of anesthesia awareness. Not blood, not gore, control. Or rather, the complete loss of it. So how do doctors reduce the risk? First, they ask about your history. If you have ever had anesthesia awareness before, that matters. They review medications, alcohol use, drug use, medical conditions, and the type of surgery. During the operation, they track vital signs constantly. They adjust anesthetic drugs. They watch for signs that the body may be reacting. In some cases, doctors may use brain monitoring systems such as BIS monitoring to estimate the depth of anesthesia. These tools can help, but they are not magic mind readers. A number on a screen is not the same thing as directly reading consciousness. That is why the best protection is not one device. It is the whole system. Trained anesthesiologists, careful dosing, monitoring, communication, and fast response when the body changes. Modern anesthesia is incredibly effective. Millions of surgeries happen safely. Most people go under, wake up later, and remember nothing except maybe saying something embarrassing in recovery, which is probably the real common danger. But anesthesia awareness sticks in our imagination because it attacks a basic assumption. When you are unconscious, you assume you are gone, paused, absent. But consciousness is not a light bulb. It is more like a dimmer switch connected to a complicated machine. And under rare conditions, that dimmer can flicker long enough to hear a voice, long enough to feel pressure, long enough to realize the most terrifying thing possible. You are awake, but nobody knows. And that is the real horror. Not that surgery is unsafe, not that anesthesia usually fails. It does not. The horror is that the thing you call you depends on chemistry, timing, and a brain that can vanish from the world, then suddenly return before anyone invited it back. So the next time someone says anesthesia is just like sleep, you know better. Sleep is natural.
anesthesia is engineered, and every time it works, which is almost every time, it is not boring. It is one of the strangest controlled miracles in medicine. If this made you rethink what it means to be unconscious, hit subscribe. And if you want another medical nightmare explained without the Hollywood nonsense, watch our video on what would happen if your body stopped feeling pain. Thank you for watching. See you next time.